Good morning. I want to thank Jill Hunsaker-Ryan for this opportunity to testify here in Edwards today. My name is John Staight. I'm 51 years old. I am a public servant, having worked in a professional capacity for Eagle County government, Boulder County government, and the town of Eagle for the last 22 years. My story starts in 1987 when I was a freshman in college. I went through a rough patch, as many adolescents and young adults do. My high school girlfriend broke up with me, and I began to fail my chemistry class. I went to student health, and after a 15-minute appointment, walked out with a prescription for Xanax. Little did I know that prescription would change the trajectory of my life. I was a diligent, compliant patient. I took my Xanax prescription exactly as prescribed by my doctor. A few years after being started on Xanax, I suffered my first panic attacks. Then I had my first episode of depression, for which I was prescribed Zoloft. I was told by my psychiatrist I had a chemical imbalance that resulted in my generalized anxiety disorder and major depressive disorder diagnoses. Those diagnoses made me feel broken and at risk. I felt I needed to take good care of my mental health by seeing a psychologist and a psychiatrist on a regular basis. Over the years, the number of meds that my psychiatrist prescribed creeped ever upwards. First the Xanax, then an antidepressant, then an atypical antipsychotic and a mood stabilizer, to supposedly augment the effect of my antidepressant. The doctor would periodically switch up my cocktail in the typical trial and error process. Reflecting back, those periods of transition were my roughest times. Periodically, I'd ask my psychiatrist if I could reduce my medication load. He'd agree to a trial and would then taper me off the medication in a standard 4 weeks. Those were the times that I would slip into a horrific state of depression. My wife and I remember those times vividly due to the crying, the anxiety, the irrational rage, and the acute feelings of worthlessness and despair. As happens with so many patients, my doctor would tell me that this acutely depressive state was the reemergence of my underlying disorder and proof that I needed to remain on my medication for the rest of my life. I now know that narrative I was told was simply wrong, scientifically unfounded. What I was experiencing was simply drug withdrawal. Fast forward to 2013. Life was going really well. My wife and I were pregnant with our first child. I was very happy at work, but I began to experience unexplained health problems. First fatigue, and then pain in my muscles and joints. I went to see my primary care physician, who had no answers. My tests were all normal. Then severe chest pain and muscle spasms. Then cognitive impairment so severe that my wife thought I had had a stroke. Seeking answers, I started going to specialists, cardiologists, neurologists at CU, rheumatologists, and I even made a trip to the Mayo Clinic. My list of symptoms had grown to 45 distinct symptoms. I was becoming disabled. My wife and I were concerned I was dying. I'd ask every doctor I saw, could it be something to do with my psych meds? The answer was always an emphatic no, it is not your meds. Since doctors could not find a definitive cause, I told my psychiatrist I wanted to eliminate variables. I asked him to taper me off of my meds. He agreed to do what he called a slow taper, but there was nothing slow about it. One day I made a dose reduction of my Valium, as my doctor had directed me to do, and within 24 hours I was acutely suicidal for the first time in my life. So suicidal that I drove to a remote dirt road, hiked up the side of a hillside, with the intent of jumping off the cliff on the other side. Visions of my 2-year-old daughter and my 4-year-old son were the only thing that stopped me from jumping that day. Prior to that dose reduction, I was not depressed and I was not suicidal. At that moment, my wife and I stopped trusting my doctor. We Googled Xanax withdrawal, Valium withdrawal, benzodiazepine withdrawal. To our shock and dismay, all 45 chronic illness symptoms were listed on online patient forums. We found a document called the Ashton Manual, published by a UK doctor who is the foremost expert on benzodiazepine withdrawal. Dr. Ashton describes how patients prescribed benzodiazepines for a long period of time develop tolerance to the medication, resulting in a worsening of their anxiety that turns into depression. It's not unlike how a patient taking an opioid will develop tolerance and experience pain that is worse than the original pain for which the medication was prescribed. Suicidal ideation can occur with rapid reduction. I couldn't believe it. I had seen 34 Colorado doctors over 5 years, and not one recognized the symptoms of benzodiazepine tolerance and withdrawal. For more than three decades, I was a trusting, compliant patient. I entrusted my mental health to medical experts from respected institutions. I now know I experience what's called medication spellbinding, a term coined by psychiatrist Dr. Peter Bregan. It's the belief that your medication is somehow helping you, even though your mental and physical health are declining over time. I looked for more answers. I read journalist Robert Whitaker's book, Anatomy of an Epidemic. Magic Bullets, Psychiatric Drugs, and the Astonishing Rise of Mental Illness in America. Whitaker highlights the paradox that while we have more access to psychiatric medication treatments than ever before in human history, our rates of suicide and mental health disability have skyrocketed over the last 3 decades. I believe all members of the task force should read Anatomy of an Epidemic. The data shows that benzodiazepines, like Xanax, are recommended for only 2 to 4 weeks for acute anxiety symptoms. I was prescribed Xanax for 30 years. I just have a couple more paragraphs. We are naive if we think the overprescribing and deceptive pharmaceutical marketing practices we've seen with the opioid epidemic are confined to just that one class of medication. The latest statistics show 1 in 5 Americans are prescribed a psychiatric medication in a given year. I'm sure that holds true here in Colorado. We definitely have a shortage of affordable mental health services like good psychological therapy. But patients in Colorado have no shortage of access to psychiatric medication. Any Coloradan in distress on any given day can walk into their primary care physician and walk out with a prescription for a powerful psychiatric medication. An important new documentary I've had the privilege to become involved with just debuted at the Santa Barbara International Film Festival. The film's title, Medicating Normal. I have a copy of the film, and I have permission from the directors to show it to the task force. I encourage you to go to the Medicating Normal YouTube channel and see clips from the film. The film perfectly documents what patients like me have been through. Also, the CNN docuseries This Is Life with Lisa Lane recently aired an excellent hour-long episode on benzodiazepines. It can be viewed on Amazon Prime and downloaded from iTunes. I encourage you to focus on what the governor asked you to do. Acknowledge that the current system is broken. Think outside the box and be innovative about solutions. If Colorado simply tries to increase the access to medical-based treatments, I fear we will see the same poor outcomes that other states continue to experience by chasing the biomedical paradigm of mental health care. The epidemic will continue. We are counting on you to do better. Lives depend on it. I was a good, compliant patient, and I almost paid the ultimate price.